The second group are we call regulatory disorders or regulatory problems. The regulatory disorders and regulatory problems are where the child does not have a significant impairment in relating, communicating, or thinking that would qualify them for an autistic spectrum disorder or a broad set of developmental problems, where, in other words, where their communication and language skills and cognitive skills are progressing within the range of expected. But the child does have clear processing problems in terms of sensory overreactivity or sensory underreactivity or sensory craving or auditory processing and language or visual spatial processing or motor planning and sequencing. So the child has one of our processing problems in the individual processing differences area. Remember our DIR model. But it hasn't significantly derailed the functional, emotional, developmental capacities. It has constricted them or narrowed them, but it hasn't totally derailed them. So the child can relate, communicate, and think. Now, we've identified a number of types of regulatory disorders. The hypersensitive or overreactive type. This is typically the child who tends to be more anxious and fearful, but here we diagnose it as a regulatory disorder rather than anxiety disorder if the processing contribution is significant and clear. So if it's a child who's just a little sort of sensory reactive and a little bit auditory reactive, and it's not a very clear or dramatic regulatory contribution, and shows a lot of anxiety, and it really isn't a part of a chaotic, overwhelming family, we would tend to more diagnose as an anxiety disorder. If, on the other hand, the biological contribution is very strong, it's a very sensory overreactive child, then we would tend to diagnose as a regulatory disorder. In practice, it's not critical to make that distinction because your work with the child is going to be very much the same anyhow. You're going to work on both components, the physical component and the interactive component in either case. But just for administrative diagnostic purposes, that's the difference in emphasis. We wanted to have a category of regulatory disorders to emphasize the processing contributions. Because that requires often an occupational therapist to be involved, for example, or in the case of an auditory processing problem, a speech pathologist to be involved. And typically, there are a lot of children who come into the mental health system who don't have the necessary teamwork, i.e. don't have the occupational therapist or speech pathologist involved, and that can be a problem. That's why we wanted to have the category of regulatory disorders. It would orient us towards appropriate treatment. So one is the overreactive type. The child tends to be fearful and anxious. Another is the underreactive type, where the child is underreactive to touch and sound and tends to be more self-absorbed. So the underreactive, more self-absorbed type of child who's not in his own world and has not derailed language to any significant degree or cognitive skills to any significant degree, but the child tends to, for example, do pretend play on his own and uses escape into fantasy and self-absorption as a coping strategy with the world. Whenever they're anxious, they shut down and self-absorb more. Often this child may have a little bit of low muscle tone as well, the underreactive self-absorbed type. Another type of child is the sensory craving type. This is the child I mentioned before, tends to be more impulsive, move around, banging into everything, active, crave sensation. Another type is the child who's characterized by severe dyspraxia, motor planning problems. Later on, this child may be diagnosed with attentional problems. Most of the kids I see with ADHD actually have significant motor planning and sequencing problems. And yet, it's often, again, if the child comes in the mental health system, it's often not worked with. Just the mental health components are worked with, which is why we want to highlight it as a regulatory type. Now, many children with regulation problems are mixtures. They're a little bit underreactive and overreactive, may even have some sensory craving features. We've identified a group of children that are very interesting. They are sensory overreactive, But when they get overloaded, instead of shutting down, as most sensory overreactive children do, becoming cautious and fearful, they turn the switch and become sensory craving and become very active and impulsive. And many of these children are diagnosed in the mental health area as bipolar children, because they go from fearfulness and sometimes depression to kind of hyper, irritable, aggressive behavior. And this flip-flop gives them that bipolar flavor. We've written a book that's out there in the book area called Children with Bipolar Patterns, where we identify the regulatory underpinnings, this tendency for sensory overreactivity coupled with sensory craving, and how it plays out at each of the functional, emotional, developmental levels, and what to do about it, and how to work with children using both the principles, using all the DIR principles that we're talking about. But basically you need to be both very regulating with these children, very firm but gentle limit setting, and soothing, and not get caught up in the vacillation that most environments get caught up in, which is getting overly punitive when they're irritable and aggressive, and overly protective when they're fearful and anxious, and vacillating quickly. Because typically the children will have a pattern, a 9-year-old who is beats up their little brother or sister, and then mommy and daddy overreact and get real angry at them, and then they're out on the roof threatening to kill themselves. Again, because unlike the typical sensory craving child who's got a thick skin and doesn't get terribly depressed, these children will get very depressed as soon as they get guilty for what they've just done, because it's that flip-flop. So it's a very hard group to work with unless you understand the underlying regulatory underpinning. So we have a lot of mixed types of regulatory problems. One of the more important ones is this type of sensory or sensory craving and sensory overreactive child. There, again, the types I've mentioned to you, it's not so critical, even though for administrative purposes we've organized them into different subtypes. But again, as we were talking about yesterday, most of these are dimensional processes. They're not categorical really. So we use the types just as a way of kind of organizing information, but in actuality you want to look at every child's regulatory contributions, how sensory under or overreactive they are in each modality, how sensory craving they are in each modality, how good or bad is their motor planning and sequencing, what is their visual spatial processing like, and what is their affective regulation like as a consequence of that. And through that sort of analysis, you understand the underlying processing part of it. That's the individual difference part of our DIR model. And so those are our regulatory disorders. And the regulatory problems require a combination of intervention approaches that involve working with the interaction patterns with the child, with caregivers, and direct interaction, with therapists, helping the child be better co-regulated affect signaler, and helping the child elaborate symbolically when they get symbolic, if they are already symbolic, what's on their mind through play or through talking.